Thank you for joining our Medicare 101 class, which will cover Parts A, B, C, and D. This program is presented by the Denver Regional Council of Governments State Health Insurance Assistance Program, or SHIP for short, which serves Arapahoe, Douglas, and Jefferson counties in Colorado. If you're outside of this area, some information may be different in your state. Medicare plan options can vary by county, so reach out to your local SHIP office for help understanding the Medicare options in your area. You can use the website www.shiphelp.org to find contact information for your state's SHIP. This project was supported in part by a grant from the U.S. Administration for Community Living. Points of view or opinions do not necessarily represent official Administration for Community Living policy. Before we jump in, if you need digital accessibility assistance, please submit a request at drcog.org/access or call 303-455-1000. Please expect a response within 72 hours or 3 business days. Today, we're going to cover Medicare topics such as how and when to enroll into Medicare, Medicare Part A, Part B, Part C, and Part D, the services covered by Medicare, and plan options for people with Medicare, such as Medicare Advantage and Medigap. We'll also discuss important terms to know, how to find help with Medicare costs, enrollment dates, how to protect your Medicare benefits, and contact information if you need Medicare assistance. Medicare is health insurance provided by the federal government, also known as Original Medicare. Original Medicare is administered by the Centers for Medicare and Medicaid Services, sometimes called CMS for short. When you first enroll in Medicare, you'll receive a red, white, and blue paper card in the mail. The card will list your Medicare number, as well as your Part A and Part B effective dates. Most people become eligible for Medicare when they turn 65. However, certain situations may make you eligible sooner. People who have been receiving Social Security Disability Insurance, also known as SSDI, will become eligible for Medicare after 2 years. People who have a diagnosis of end-stage renal disease or Lou Gehrig's disease, also known as ALS, will become eligible sooner. You must be a U.S. citizen or lawfully present in the United States to be eligible for Medicare. For most people, their initial enrollment period coincides with their 65th birthday. If you are not automatically enrolled in Medicare, you will need to enroll through Social Security during the 7-month period that includes the 3 months before your birthday month, the month of your birthday, and the 3 months after. There are 3 ways you can enroll. Online by setting up an account at ssa.gov, over the phone by calling 1-800-772-1213, or in person by calling your local Social Security office to make an appointment. Some people will be automatically enrolled into Medicare and will receive their red, white, and blue Medicare card in the mail as notification. You'll be automatically enrolled if you've been receiving Social Security retirement benefits for 4 months or disability benefits for 2 years. People receiving Railroad Retirement Board benefits will also be automatically enrolled. To ensure their coverage starts as early as possible, most people choose to enroll in Medicare 3 months prior to their birthday month. When you enroll in Medicare during the 3 months before your birthday, your coverage will start on the first day of the month you turn 65. If you wait until your birthday month or the 3 months after, your benefits may be delayed. If you enroll after your birthday, your coverage will start on the first day of the month following enrollment. This timeline applies to most people who enroll in Medicare, but there are some exceptions. Now let's learn the ABCs of Medicare. Part A, also known as hospital insurance, covers your inpatient hospital coverage. We'll talk more later about how to know whether you're an inpatient or an outpatient. Part B is medical insurance and covers your outpatient medical services, such as doctors and specialists. It also includes your outpatient hospital coverage for emergency room visits and even some surgeries. We're going to skip over Part C and come back to that in a moment. Part D is your prescription drug coverage for medications you receive through the pharmacy. Part D plans are only offered by private insurance companies. Now let's go back to Part C, which is referred to as a Medicare Advantage plan. Medicare Advantage plans bundle coverage and include your Part A, Part B, and usually Part D. A Medicare Advantage plan will always be through a private insurance company, which will manage your hospital, medical, and drug coverage. Let's take a closer look at these plan options. Part A pays for a portion of your inpatient hospital care, skilled nursing facility care, blood you get as a hospital inpatient, home health care services, and hospice care. Skilled nursing facility care is the rehabilitation care you receive after an inpatient hospital stay. It is not long-term care. There are limits to how long someone can receive skilled nursing facility care through Medicare. Similarly, home health care services are only provided part-time or intermittently. They're not provided long-term. Medicare doesn't cover home health care services unless you're also getting skilled care. Skilled care includes skilled nursing care, physical therapy, speech therapy, and occupational therapy. Part B helps to cover doctor services, medically necessary outpatient medical services, medically necessary surgical services and supplies, clinical lab tests, durable medical equipment such as walkers and scooters, diabetic testing supplies, and preventative services. With Medicare Part B, you will pay nothing for certain preventive services. It's important to be aware that during your visit, your doctor may order additional non-preventive tests or services that would require you to pay the Part B deductible or copayment. When you schedule your appointment, be sure to ask for either your Welcome to Medicare visit or your annual wellness visit so that you're billed for a preventive visit. You'll want to ask for the Welcome to Medicare visit within the first 12 months of enrollment and the annual wellness visit every year following. Medicare Part B also covers several other preventive services, such as most routine vaccinations, except for shingles, which is covered by Part D, diabetes education, colorectal and prostate cancer screening, bone mass measurement, mammograms, depression screening, and counseling for obesity and tobacco cessation. Part A is premium-free for those who have worked and paid payroll taxes for 10 years. You may also qualify for premium-free Part A based on your spouse's or past spouse's work history. If you're unsure whether you will receive premium-free Part A, call the Social Security Administration at 1-800-772-1213 to determine your eligibility. If you do not qualify for premium-free Part A, you will have to pay a Part A monthly premium. If you've worked for at least 30 quarters, or about 7.5 years, prior to enrolling in Medicare, your Part A premium will be $311 a month. If you've worked fewer than 30 quarters, your Part A premium will be $565 a month. Everyone pays the Part A deductible, which is $1,736 for each benefit period. A benefit period begins the day you're admitted as an inpatient to a hospital or skilled nursing facility and ends once you've been out of the hospital or nursing facility for 60 days in a row. During your first 20 days in a skilled nursing facility, you will not pay any additional costs. Starting on day 21, you will pay $217 per day until your benefit period ends at day 100. For days 101 and beyond, you will be responsible for all costs. Copays for each benefit period will vary based on the number of days you're in the hospital. There is no copay if your benefit period is 60 days or fewer. From 61 to 90 days, you'll pay $434 per day of each benefit period. If you've used your 90 days of hospital coverage but need to stay longer, Medicare covers up to 60 additional lifetime reserve days, for which you will pay a daily coinsurance of $868 per day of each benefit period. Beyond your lifetime reserve days, you will pay all costs. Part B has a standard monthly premium of $202.90 and an annual deductible of $283. You will need to meet the deductible before you begin paying your coinsurance. Medicare Part B generally pays for 80% of covered services. You would pay a 20% coinsurance out of pocket. Part D drug insurance is provided through private insurance company plans. Part D plans cover your outpatient prescription drugs from your pharmacy. It's important to review plan details to ensure the prescriptions you take are on the formulary and will be covered by the plan. If they're not on the formulary, you'll be responsible for the full cost of the drug. SHIP counselors can help you evaluate formularies and complete plan comparisons with you to help you find the most affordable plan for your situation. Part D costs include an average monthly premium of $38.99, an annual deductible of $615 if applicable, and copayments or coinsurances that could vary greatly depending on the plan you choose. You can review the plan options in your area with a SHIP counselor to help you understand the costs and options available to you. There are 3 phases of Part D coverage, which will determine how much you have to pay toward the costs of your prescription drugs. When your coverage begins, you will pay for your medications until your deductible is met. Once your deductible is met, you and your plan both pay towards your medications. If you've met your out-of-pocket maximum of $2,100, you've entered what's known as a catastrophic phase, and your plan pays all costs. If you have Medicare and take insulin, you will pay no more than $35 for a 1-month supply of each type of insulin you take, and you won't have to pay a deductible for covered insulin. If you use other prescription drugs for diabetes management, including injectable drugs such as Ozempic or Mounjaro, they are not covered by the prescription drug law's cost-sharing cap of $35 a month. For Part D vaccines, you will not have to pay a copay or coinsurance. Medicare Advantage plans bundle Part A hospital, Part B medical, and usually Part D drug coverage through a single private insurance company. If you're familiar with an employer plan, a Medicare Advantage plan might seem similar. Medicare Advantage plans are most often a health maintenance organization, HMO for short, or a preferred provider organization, PPO for short. HMO plans require that you see providers listed in their network. A PPO plan allows you to see preferred doctors in or out of its network. Some plans offer incentives such as limited dental, vision, and hearing benefits, most often for preventive services. Some plans may also offer Silver Sneakers, a fitness membership. If you join a Medicare Advantage plan, you'll still pay the Part B premium of $202.90. In some cases, Medicare Advantage plans have no additional premium. Other plans may have an additional monthly premium. Each plan will have its own set of deductibles and copays or coinsurances for services. It's very important to review plans closely to ensure you understand what is and is not covered. Even more importantly, you'll want to ensure your doctor is in network with the plan. SHIP counselors can help you review your Medicare Advantage plan options and help you understand the costs and coverage for each plan. One plan option we haven't talked about yet is the Medicare Supplement Insurance Plan, also called Medigap. To join this plan, you must have Original Medicare, which is Part A and Part B, through the federal government. You cannot sign up for a Medigap plan if you have a Medicare Advantage plan. There are more than a dozen Medigap plan options, ranging from letters A through N. The amount of coverage varies based on the letter plan. Medigap usually helps pay your portion of the costs, like deductibles and coinsurance, for services that Part A and Part B cover in Original Medicare. For example, Medicare pays 80% of your costs, and Medigap may cover your 20% responsibility. It's important to note that Medigap is private insurance, so you'll pay a monthly premium for it in addition to your Part B premium. Contact your local SHIP for more information about Medigap policies and the companies that offer them. Now that you've had an introduction to Medicare's various parts, choosing coverage comes down to a decision between two options. First, you need to decide whether you want Original Medicare, which includes Part A and Part B, or a Medicare Advantage plan, which typically bundles Part A, Part B, and usually Part D drug coverage. If you go with Original Medicare, your next step is to add Part D prescription drug coverage. And finally, you'll want to decide which Medigap supplemental policy is right for you. If you choose a Medicare Advantage plan, you may or may not need to add Part D coverage. Most Medicare Advantage plans do include prescription drug coverage, but if the one you choose doesn't, you may be able to add it through Part D. Remember that if you choose a Medicare Advantage plan, you won't have the option to purchase a Medigap policy too. Now that we've covered your options, we can review some important Medicare terms. Original Medicare refers to the Medicare-approved amount for covered services as assignment. If you have Original Medicare, it's important to ask your provider if they accept assignment as full payment. You may also want to ask your durable medical equipment company if it accepts assignment. If your provider does not accept assignment, but still accepts Medicare, they may charge up to an additional 15% coinsurance. Combined with the Original Medicare coinsurance of 20%, you may pay up to a 35% coinsurance. If you're ever in the hospital, it's important to know whether you're an inpatient or an outpatient. Your status might change from one day to the next. Generally, if you're in the hospital for 2 nights or more, you're an inpatient. You're an inpatient starting when you are formally admitted to a hospital as an inpatient with a doctor's order. The day before you are discharged is your last inpatient day. Every day you're in the hospital, be sure to ask whether you are considered an inpatient or an outpatient. Your status determines whether Part A, inpatient hospital, or Part B, outpatient medical, deductibles, copays, or coinsurances apply for that day's hospital stay. This distinction is especially important if you're transferred to a skilled nursing facility, because Medicare will only cover your care there if you have a qualifying inpatient hospital stay of at least 3 days in a row first. This includes the day you were admitted as an inpatient, but not the day of your discharge. The Advanced Beneficiary Notice of Non-Coverage is referred to as an ABN form. You may receive this form if you have Original Medicare, and your provider thinks Medicare won't pay for the items or services you're going to receive. Your provider gives you an ABN form, so you know you may be personally responsible for the full cost of the item or service. If you choose to go ahead with the item or service, you'll need to accept responsibility for payment if Medicare denies payment. But keep in mind that if Medicare denies payment, you do have the right to appeal. You may have heard the term medically necessary. It describes the criteria Medicare uses in determining whether it will cover a service. Your doctor must assert that an item or service is medically necessary for your treatment for it to be covered. Another key term is creditable coverage. Creditable coverage refers to health insurance that is comparable to or exceeds Medicare's approved coverage. Some people choose to keep an employer plan instead of enrolling in Medicare. If you choose not to enroll in Medicare, you'll want to ensure that you have proof of creditable coverage provided by your company or your spouse's company to avoid penalties later. There are programs that help people with costs related to Medicare. The low-income subsidy, known as Extra Help, assists with costs for Medicare prescription drugs. A SHIP counselor can help you find out if you qualify for this program and help you apply either online or through your local Social Security office. People who receive long-term care Medicaid, a Medicare savings program, or supplemental security income benefits will automatically qualify for this program. If you're eligible, you will need to reapply each year. The Medicare Savings Program, or MSP for short, can help you with your Part A or Part B premiums, copayments, and coinsurance. MSP has various levels of assistance depending on your income. SHIP counselors can help you find out if you qualify and help you apply through Health First Colorado, the state's Medicaid agency. This will determine whether you're eligible as a qualified Medicare beneficiary, a specified low-income Medicare beneficiary, a qualifying individual, or a qualified disabled and working individual. Some people may qualify for both Medicare and Medicaid, which is known as dual eligibility. In this case, most of your healthcare costs will be covered because Medicare will pay first and Medicaid will assist with the remaining costs. You will have to cover a small copay out of pocket. Medicaid may also cover things Medicare doesn't, such as some drugs and dental services. If you have Medicaid and are becoming eligible for Medicare, it's important to talk with a SHIP counselor to coordinate your benefits. Now, an important date refresher. Your initial enrollment period is the 3 months before your birthday, the month of your birthday, and the 3 months after. For people receiving Social Security disability insurance, automatic enrollment will begin on the 25th month of your SSDI benefit. Remember that you'll want to enroll in Medicare through Social Security during the 3 months before your 65th birthday to avoid delays. If you miss your initial enrollment period and you didn't have other creditable coverage, you'll have to apply during the general enrollment period. You can sign up for Part A and Part B between January 1st and March 31st of each year. However, your coverage won't begin until the 1st of the next month. A penalty will usually apply, and you risk having gaps in your healthcare coverage. The Medicare Advantage open enrollment period gives people with Medicare Advantage plans an extra chance to make changes. You must have an existing Medicare Advantage plan to make changes. If you're in original Medicare, you do not qualify for this period. You can only make one change during this period. For example, if you joined a Medicare Advantage plan during the fall open enrollment period, but found out in February it doesn't cover your doctor in-network, you can change your plan during this period. When switching from a Medicare Advantage plan back to original Medicare, contact the Medigap company before you switch, since underwriting may make a Medigap policy too cost prohibitive to pick up again. There's a special enrollment period for people who have had creditable coverage and now want to enroll in Medicare. You have 8 months from losing your creditable coverage to enroll into Medicare through Social Security. You must provide proof of your creditable coverage. COBRA is not considered creditable coverage for Part A and Part B. Once you're enrolled in Medicare, you may have a special enrollment period to change your Medicare Advantage or prescription drug plan. Some events that may make you eligible for a special enrollment period include moving, plan non-renewal, if you have extra help or a Medicare savings program, or if you lose your Medicaid status. It's important to note that special enrollment periods for those with extra help happen once a month to allow for enrollment into a standalone Part D plan. SHIP counselors can help you determine whether you meet the qualifications for any special enrollment periods. The open enrollment period is when people choose to add, drop, or change their original Medicare, Medicare Advantage, and Part D drug plans. You can make changes from October 15th to December 7th each year. Your old plan will end on December 31st, and your new plan will begin on January 1st. You won't face any penalties for making changes during open enrollment. You are encouraged to review your plans each year to make sure you're still happy with the cost of your premiums, deductibles, and copays. Check that your existing plan will still cover your prescriptions and doctors in-network. Plans change from year to year, and while they may still have the same name, the coverage could be different. Be sure to review your annual notice of change every fall so you don't have any surprises in the new year. Medigap, also known as a supplement insurance plan, pays after Original Medicare, so it's considered a secondary insurer. For this reason, they are able to review your pre-existing conditions to determine whether they want to sell you a Medigap plan. There is no open enrollment period for Medigap. During your Medigap guaranteed issued right, which is 6 months from the time your Part B began, you have the right to buy a Medigap plan. During this time, you cannot be denied a plan. Outside of this window, a plan has the right to deny you or increase the premiums if they insure you. A SHIP counselor can help you understand your options and navigate Medigap plans and guaranteed issue rights. Protect your Medicare number like you would a credit card. Only share your Medicare information with trusted sources, such as your providers and doctors. Beware of scams that try to get your Medicare number to bill you or Medicare for services that you did not receive or did not need. Review your Medicare summary notice or explanation of benefits every month to make sure they're correctly billing you and Medicare for services. If you find any errors or suspicious information in your Medicare summary notice, notify your local SHIP. If you've enjoyed this presentation and think you may want to learn more about Medicare and volunteering with SHIP, you can call your Colorado SHIP program at 303-480-6835. SHIP counselors must go through an application, interview, and background check process. The Area Agency on Aging provides up to 40 hours of training and will sponsor your counselor certification. If you're certified and trained as a counselor, you might also consider becoming an outreach volunteer. These volunteers help conduct Medicare Basics classes and attend health fairs and special enrollment events on behalf of the Area Agency on Aging. If you live in Arapahoe, Douglas, or Jefferson counties and need any assistance with Medicare, you can call the SHIP at 303-480-6835 or email us at ship@drcog.org. We're open from 8 a.m. to 5 p.m. Monday through Friday, and all appointments are by phone only.